Arthritis Day. This is a very special day for those people who are going through the trauma of joint aches and pain. Worldwide, the World Arthritis Day is celebrated to improve the awareness of arthritis. Many a times it happens that the joint pains goes unrecognized. You do not know what you're going through. It's an ache and pain, and it's just treated then and there as and when on the need basis. There is a term called rheumatism which implies that you have some pain and ache around the joint. But much more important than that is the arthritis, the inflammatory arthritis, which can be treated, which can be held back. So the World Arthritis Day says the future is in your hands. So the inflammatory arthritis, if it is identified at an early stage, can be identified properly, and the right treatment can be started at the earliest so that the joints can be saved, your joints can be conserved, and they are not damaged. So the aim is to preserve and retain the function of the joints as anybody. The purpose of our joints is to move. Unless you move, you cannot have a healthy heart or a healthy brain or a healthy kidney, because all these organs need an ample blood flow. So to maintain these vital organs, you need to be on the move. These days all are talking about physical fitness, burning the calories, and maintaining the blood flow to all the major organs. So if you need to take care of your major organs, you need your joints to keep you moving. So the first step is to know what you have. So whenever you come across with pain or aches or morning stiffness, never ignore it. Go to a doctor, a specialist physician, or if possible a rheumatologist, and get yourself checked. There is no harm in going through the tests and knowing what you have, whether it's that arthritis which needs a treatment or the form which just needs a supportive and symptomatic care. So the doctor will examine you, the rheumatologist, they will examine your joints in detail, and they will do certain tests. These days we have a lot of special tests. The antibody tests talked about, there are various antibody tests, and they would be decided based on your symptomatology. Let's talk about rheumatoid arthritis. That is the commonest inflammatory arthritis, which affects nearly 1% of the world's population, and mostly they are women. For every one man, 3 to 4 women have this. And this rheumatoid arthritis tends to affect one in the prime of life, in their 30s and 40s. So if this is identified at an early stage, and the specific medications called the DMARDs are the medicines which would control the inflammation in the joint and halt the damage, halt the inflammation, and subsequently prevent the damage and maintain your joints with a normal function. So it's about treating arthritis and relieving of your symptoms. Many times it happens that though you are on the medication, you keep feeling the aches and pains. But still, it is better, the joints are not getting worse. If you do not treat your arthritis would be seen, though you may continue to feel it. So when you have a joint pain, don't ignore it. Act promptly, get yourself checked, and clarify whether it's an inflammatory or just a wear and tear joint. If it's an inflammatory arthritis, then you start your treatment. So when the diagnosis of an inflammatory arthritis is confirmed, it's better you know more about your arthritis. Know what your arthritis is, whether it's an inflammatory arthritis, whether it's a rheumatoid or a psoriatic or the other arthritis. Know about your tests, because you may move from one part of the world to the other. If you know that I'm having rheumatoid arthritis and my rheumatoid factor is positive and anti-CCP is positive, it is better, so your treatment would not be unnecessarily delayed. Then know about your medications, know about the side effects and the symptomatic medications, minimize their use, try to use it optimally, talk to your physician. The other thing will be to form groups, be in contact with others having arthritis, so that your journey with arthritis tends to be easier, and you be able to control your joint disease. I would also like to talk about the osteoarthritis, the commonest arthritis, it's a wear and tear arthritis, which is usually seen in elderly. This is a wear and tear arthritis. With age, the joint, the water content of the joint comes down and the cartilage shrinks and the bones come close to each other. The joint space is narrowed and the bones come closer and the joint gets damaged. By the age of 90, nearly everybody would be having it. Rarely at a younger age you can get it, especially when your job or when your routine involves too much of physical activity, especially those in sports. In that also, you can involve regular physical activity, avoid injuries, you can adopt joint protection strategies so that you can delay it. One of the myths of arthritis is that only elderly get it. It's wrong. Even kids can get arthritis. Even at the age of 1, you can get arthritis. Kids do get arthritis, that's very much treatable, provided they are looked into, taken care of specifically, and the kids grow also. So that aspect of child, the aspect that they grow, the bone growth is there, should also be considered, and the appropriate treatment should be adopted. Few tips to arthritis. Exercise regularly, avoid stress, take a balanced diet, include a diet rich in fruits, vegetables, high in fiber. If you take fish, you can include fish rich in omega-3 like salmon, mackerel, or sardine at least 2 or 3 times a week. They say consumption of omega-3 may prevent arthritis, especially rheumatoid arthritis. Stop smoking if you are, quit it. Stay hydrated. Hydration can delay osteoarthritis, as well as being hydrated can avoid gout flares. Take your medications regularly, get your lab tests done, and stay stress-free. One more thing is about vitamin D. Vitamin D also has a very important role in the prevention of arthritis, rheumatoid, and osteoarthritis. So get your vitamin D levels checked. If it's low, get supplemented. So stay healthy, be on the move always, be light, eat light, and think light, be stress-free. This can help you to beat arthritis. So wishing you all on this day of World Arthritis for a pain-free arthritis, and hopefully you will be able to conquer the pain of arthritis and you succeed in your journey. It's about living with arthritis. So wish you all the best on this eve of World Arthritis Day. You can, all of you can raise the awareness about arthritis. If you come across somebody who has aches and pains, help them, guide them, and also you can share with them about the importance of the medications and following them regularly.